already recording.
Okay. I wanted to get started because most of you know that are here in the room, or those of you that are at home, that I've also done kind of this series that you got to use your brain or you're going to lose it. So this talk that I'm doing today is called Easy Breathing, and it's a talk that I had done, I think like in 2020. And so when I pulled it up, it's like, oh, look at here. We've got some old little puzzles. And so let's just see how well you guys do, if you have any idea what these puzzles mean. And so can you see my cursor? Yeah, so what's that first one? So if you're at home, be sure you unmute your microphone. Otherwise, John will say all the answers. Even he's got a mask on, so at least it will be muffled. Anyone have an idea what number one is?
C's.
7 C's.
7 C's.
7 C's. Yeah. Okay, how about where's my cursor? Here we go. How about the next one? Leftovers. I'm going to get the answers. So bad. So we're on this one right here. Anybody? How about you guys in the on the Zoom?
Count on us.
Yes.
Oh.
Counting on us. Did you know that, John?
No.
Did you?
I didn't.
Oh, okay.
That's the one I didn't know.
Okay.
That in the lower right corner. I can see it.
How about that one? The purple arm. Where's my cursor? This one.
Oh, I can't even.
I can.
This.
Yep. I'll tell you what it is.
Oh my goodness, that's
Well,
But how about this purple one? Anybody?
purple ring.
Arm in arm.
Oh, for crying out loud.
I know. You know what? Yeah. Okay, here we go. Second row. What'd you say? Sugar daddy.
Sugar lover. Sweetheart.
Sweetheart. Who said that? And then this one made me laugh out loud. Defeat.
Oh, yeah. Oh, my goodness.
Now this one's tough. This is a tough one.
Hole in one.
Yeah. Do you see it? It's a hole in one. Ugh.
Or Dolly Parkinson. Only morning.
Okay. Okay, this one should be easy. So, okay, very good. And then Linda already said this one.
Yeah, that's
Okay. And how about this one?
Okay.
Okay, now I did not have the answer to this one.
Only one.
Okay,
Oh.
is that a cross?
Yeah.
Okay. Ooh, or cross the water.
Well,
No,
I kind of thought maybe holy. Any other ideas? Okay, this last one, it's really hard to read, and it's actually all those words are wink.
Oh, 50 winks.
50
That is 40 winks.
40 winks.
40 wings.
Yeah, 40 winks.
40 winks.
Oh, my goodness.
Okay. Most of you guys on Zoom are muted, so I'm assuming you're all going like, oh, of course, because that's what we're hearing here in the room. Okay, I've got some at the end too, but I want to talk a little bit about, I know Rob started off with the beginning of this week, or maybe it was last week, about anatomy of the lungs. And I used to do this talk at UC Davis. It was called Easy Breathing. And it was just some of the diseases, you know, asthma, COPD, pneumonia, things like that. And so I kind of changed it up a little bit and thought we'd talk about it here. Okay, so how am I moving my slides, Tim?
I think with arrows.
Yeah. Oh, the side arrow?
Yes.
Oh, okay. Okay, got it. So for those of you who don't know me, my name is Cari Shulkin. I'm a nurse. I worked with many years with Linda over at the cardiac rehab program at UC Davis. And I'm still a patient education educator in the health management and education department. And so easy breathing. What does pneumonia, COPD, and asthma look like? So just let me just start. For those of you who are new to the Sacramento area, the running joke is if you don't have allergies, move to Sacramento, and within a few years, you will have allergies. It took me about 10 years, but eventually I have them. So who here has asthma? Okay, or allergies. Let's start with the allergies because asthma can be related to allergies. Anyone in here has ever had pneumonia?
Oh, yeah.
Oh. Fading memory. Yeah, pneumonia is kind of scary. Or what about a diagnosis of COPD, which is chronic obstructive pulmonary disease, and it kind of encompasses chronic bronchitis or emphysema. Sometimes asthma is thrown in there. Yeah, so I just wanted to talk about some of these things, and I found some really quick, like 4-minute videos about that shows really good anatomy with these type of diseases. So let's get started. I think it's important to know that nearly 15% or about 1 out of 7. So I'm thinking, so with the number of hands that raised, that kind of follows suit here. So 1 out of 7 middle-aged or older US adults aged 40 to 79. So I'm not sure why they don't go higher. Suffer from some type of lung disorder like asthma or COPD. And so the things I wanted to talk about, and I think it was important to first off, make sure you know what vaccines if you're 65 or older, that you should have already had. And so we're going to talk about that real briefly. And then I want to talk about pneumonia, asthma, and COPD. So by raise of hands, tell me if this is something you already know and that your doctors are on top of it and you can check these off, because I hope so, because you should probably have a flu shot every year. So the fall is coming up. You're at a higher risk of having some complications from flu. So think about getting your flu shot. If you're over 65, pneumococcal vaccine. Is this the first year you've heard of it?
No.
Everyone's had it. Okay. I was kind of surprised that they said 2 shots 1 year apart, because I think you can also get it sooner than that, right? Do you know, Rob?
Single?
No. Pneumococcal.
Oh.
And depending on your chronic illnesses.
Yes, like,
Recommended.
okay.
In some cases, Really? Yeah.
What'd
What
you-
is that, Carrie? What is the pneumococcal?
It's for any type of pneumonia, for the pneumococcal pneumonia, like the most common pneumonia.
Thank you.
And then shingles. Oh, that just scared me so much. Just as we were getting older, or our parents getting shingles, and how debilitating it can be, that I've already gotten my shingles vaccine. So if you haven't, talked to your doctor about it, if it's something that you're a little nervous about. And
I
then,
had the first shot.
Yeah.
And then I had shingles. And then I had the 2 shots.
oh, okay. So there was a
shot
vaccine.
before.
There was a vaccine that was a single that didn't have a lot of coverage. Yeah. But maybe you had a lighter,
I probably, had an attenuated
yes,
case. Yeah.
yes, that's what you want if you're going to get it.
Does your doctor have to prescribe that, or can you get it from the pharmacy?
I think you can just go.
Yeah, you just go to the
Yeah,
drugstore.
for shingles, I think you can just go.
Yeah, if you go to the drugstore, it's free. If you go to a hospital, you have to pay for it.
Yeah, okay, thanks, Rose. And then there's tetanus, diphtheria, and pertussis that we've all probably been vaccinated, but if it's been 10 years, this was something that I was like, oh yeah. Ugh. So I didn't hear what you said. Not that I'm aware of. Yeah,
What was the question?
whether or not the Tdap prevented monkeypox.
No, the old smallpox vaccine.
Oh, now I hadn't even heard that.
Yeah.
Oh, okay.
Yeah, Dr. Lopez says, I can't believe it. I had that when I was 4 years old, probably.
Well, so I wonder if they're recommending like a booster for that, or is that what the vaccine
No,
is?
no. He said I'm covered.
Oh,
Yeah.
wow. Good to know. See the things we learn.
Okay,
And then-
Cari, we can't hear what's being said in Folsom Hall. So
That smallpox can
That vaccine
that
covers.
the vaccine of smallpox, if you had it as a child, would cover you for monkeypox.
I think your chances of getting that are so slim.
I think it's slim as well. I think the chances of getting monkeypox are very slim, but it's always good to know this stuff. And I'm just going to preface this that I would have to look up because I'm not aware that that smallpox does cover monkeypox. I have not heard that before.
I would think there would have been publicity, but my question for you is, what is monkeypox? How did it come about? Now we're talking about 3 people in Sacramento, 23 people. I don't know what it is.
I think that we could have a whole lecture on that, and I can't take time today to really
Okay.
talk about it because I would have to research it myself. And I would be happy to, because all those questions you have, I have as well.
Elaine, your chances of getting it are slim to none.
Yeah. But it is out there and you should be aware. And there's certain higher risk populations that I think you don't fall into. But back to immunizations, also COVID, let's just not forget about COVID. And if you're not immunized, the chances of you getting very, very sick, and that's what we want to prevent, or getting any type of pneumonia, because we know that that virus attacks our lungs. So talking to your provider about any of these immunizations is like key. Do you feel like you're all pretty knowledgeable about where you're at and what you've had, and you're up to date in this group?
You know, the pneumonia one's kind of confusing because that used to be a long-term thing.
And it is. It is. You should have had it around 65. Pneumococcal, you should have had,
I've had a couple of them.
then you're probably good. Then you're probably good. If anyone has any questions, this is the time to like portal your doctor and ask, am I covered? Is my pneumococcal up to date? Because I think, Rob, help me with this, that with pneumococcal, you just get those originals and then you're good. There's no boosters for that, from what I understand. Yeah.
Should be the case, to my knowledge. One and done or?
It's usually 2 shots, but then you're good
For
pneumococcal pneumonia. Yeah,
Forever?
my understanding. Yeah. But again, and that's why I preface everything I say with check with your doctor.
Yeah, yeah.
So you can't come back and say, well, Cari said,
But I've had 2 shots, but I don't think they were a year. I think they were more than a year apart.
well, find out.
Hmm.
You can find out.
Who knows, the efficacy might change and they may modify their.
Yeah.
That's a very good point. Very good
Yeah.
point. I can't see my windows, Tim, to be able to bring this up. I want to talk about pneumonia, but I've got a really great, oh, there they are. Okay.
Just hit the Windows key and you'll find it.
Okay, very good. So I want to get started here. Make sure you can hear it at home. Give me a thumbs up or something that you can hear this little TED Talk about pneumonia.
Every time you breathe in, air travels down the trachea through a series of channels called bronchi and finally reaches little clusters of air sacs called alveoli. There are some 600 million alveoli in the lungs, adding up to a surface area of roughly 75 square meters, the size of a tennis court. These tiny sacs, only 1 cell thick, facilitate a crucial exchange, allowing oxygen from the air we breathe into the bloodstream and clearing out carbon dioxide. Pneumonia wreaks havoc on this exchange. Pneumonia is an infection of the alveoli that causes them to fill with fluid. There are many different kinds of pathogens that can cause pneumonia. The most common ones are viruses or bacteria. These microscopic invaders enter the body via droplets either in the air we breathe or when we touch our eyes, noses, or mouths after touching a contaminated surface. Then they face the respiratory tract's first line of defense, the mucociliary escalator. The mucociliary escalator consists of mucus that traps invaders and tiny hairs called cilia that carry the mucus toward the mouth, where it can be coughed out. But some of these invaders may get past the mucociliary escalator into the lungs, where they meet the alveoli. Because alveoli serve as critical exchange points between the blood and air from the outside world, they have their own specialized types of white blood cells, or macrophages, which defend against foreign organisms by enveloping and eating them. When pathogens enter the lungs, the macrophages work to destroy them. The immune system releases additional white blood cells in the alveoli to help. As these immune cells fight the pathogens, they generate inflammation and fluid as a byproduct of the inflammation. When this fluid builds up, it makes gas exchange inside the alveoli much more difficult. As the level of carbon dioxide in the bloodstream begins to rise, the body breathes more quickly to try to clear it out and get more oxygen in. This rapid breathing is one of the most common symptoms of pneumonia. The body also tries to force the fluid out of the alveoli through coughing. Determining the cause of pneumonia can be difficult, but once it is established, doctors can prescribe antibiotics, which may include either antibacterial or antiviral treatments. Treatment with antibiotics helps the body get the infection under control. As the pathogen is cleared out, the body gradually expels or absorbs fluid and dead cells. The worst symptoms typically fade out in about a week, though full recovery may take as long as a month. Otherwise, healthy adults can often manage pneumonia at home, but for some groups, pneumonia can be a lot more severe, requiring hospitalization and oxygen, artificial ventilation, or other supportive measures while the body fights the infection. Smoking damages the cilia, making them less able to clear even the normal amount of mucus and secretions, let alone the increased volume associated with pneumonia. Genetic and autoimmune disorders can make someone more susceptible to pathogens that can cause pneumonia. Young children and the elderly also have impaired clearance and weaker immune systems. And if someone has viral pneumonia, their risk of bacterial respiratory infection is higher. Many of the deaths from pneumonia are due to lack of access to healthcare. But sometimes, even with appropriate care, the body enters a sustained fight against the infection it can't maintain, activating inflammatory pathways throughout the body, not just in the lungs. This is actually a protective mechanism, but after too long in this state, organs start shutting down, causing shock and sometimes death. So how can we prevent pneumonia? Eating well and getting enough sleep and exercise helps your body fight off infections. Vaccines can protect against common pneumonia-causing pathogens, while washing your hands regularly helps prevent the spread of these pathogens and protect those most vulnerable to severe pneumonia. When it comes to keeping your hands clean and germ-free, which works better, soap or hand sanitizer? Dig into the science of how these bacteria-fighting agents work to keep you safer.
Okay, I thought that was a really kind of basic talk about how pneumonia works. And so I asked everybody who was in the classroom if anyone had pneumonia, and one person did, but what about on the Zoom? Any of you guys ever had pneumonia?
Haven't had it, but I found that a fascinating explanation because I had no idea. I've had friends that have had it. I have no idea how it worked or what. So thank you.
Oh, okay.
I've had pneumonia, Cari.
Tim, how do I get back?
Second tab.
Oh, there we go. Okay.
Then search.
Yeah. Oops. So some tests that you can, if you were diagnosed with pneumonia, you know, we would definitely have to have like some type of blood test to identify the type of organism causing the infection. Or it could be actually even a sputum, which is a fancy word for, you know, coughing up all those loogies, and they can look and see and identify what kind of organism is causing that pneumonia. Definitely a chest x-ray could see kind of that consolidation that would happen in the lungs. You know, just your little pulse ox checking how well you're being oxygenated in your bloodstream. All those things are going to be very, it will tell us a story of how well you're still being oxygenated with fighting off that infection in your lungs. Pneumonia is no joke. You know, people still die of pneumonia. So, if you're at an age or if you're compromised in any way, or you've got crappy lungs, just know that you may be at a higher risk, and it's, you know, you want to take those precautions. Treatments, of course, are antibiotics and making sure it's specific to that organism, and cough medicine. I can remember I was working on E6. Now, granted, this would have been, 20 years ago. And one of the nurses had walking pneumonia. And she coughed so hard, she broke a rib. And that was nuts to me because we were all kind of the same age. We were all in our late 20s, early 30s. And it's just like, oh my gosh, I can't even believe. And then think about it. You've got pneumonia. You do need to cough. You need to get that stuff up and out. And every time she would cough, she'd have all this excruciating pain because she had a broken rib. It was just,
So
it's
when you have
scarred me.
when you have walking pneumonia, you don't have a temperature or anything?
So walking pneumonia can be, this is exactly what she had, because I think she had enough of her own immune system to fight it to some point. So you're just not so down and out. So that's why they call it walking pneumonia.
I've often wondered about that.
And then, of course, you want to take fever reducers or pain relievers because the coughing can be just so awful, or you could just have all over body aches and things like that. Are there any questions about pneumonia?
You have walking pneumonia, does that make you more capable of spreading that to other people around you?
Yeah, if it's a bacterial pneumonia, you're at a higher risk of spreading it. Yeah. It's just when you're coughing, you're spreading all these droplets, and that's what those organisms are in, or you're coughing on the table and then Tim comes by and touches it, and then you rub your eye, or, that's,
Poor Tim.
But she was a nurse, she didn't know she had it.
I don't, what, I don't remember. It was so long ago.
Yeah.
Yeah.
Be like that. How long do they live on surface?
How long does bacteria live on surfaces? Well, I have to say, since COVID, I think we're really good about wiping things down. And I think everyone is really good about hand washing. And I think that's going to be your number one go-to. For bacterial, it seems like 48 hours, but I'd have to look that up. I can't tell you directly off the top of my head.
Depends on too, if the surface is wet.
Oh, good point. Like if the surface is wet or damp.
It can survive on some sort of medium like that. Now, some surfaces, they might actually deteriorate earlier, but
That's a good point. Rob was saying depends on what the surface is as well. Like if it's already kind of a damp surface, those bacteria may actually grow exponentially. It's hard to tell. So good hand washing, wipe down your surfaces, wear a mask.
Carrie, we just
Sure,
lost
cover your
sound.
face if you're coughing, kind of this cough, but it wasn't so debilitating that she was like off work.
Yeah.
And so that was the reason for her to eventually get
But you know
evaluated.
what? Now we feel like if you have a cold, you should stay home and don't infect
Yeah.
everybody.
Yeah, especially nurses. Yeah. Okay. I want to give you a quick little overview of where am I looking? Oops, that's not what I want. Oops. How do I find this, Tim? I'm sorry.
Hit the Windows key.
Oh, Windows key. That's what it was. There we go. Okay. And what am I looking for? Asthma, did I say?
Well, you're making me feel really good.
I need help, Tim. I can't find it.
It's the, sorry, the third one. PowerPoint,
Oh, it's, no, I was looking
or
for
what are you looking for?
asthma.
Oh, right here.
That's pneumonia.
Sorry. This one, sorry.
No.
Is this?
Asthma works. Chris?
Yes,
Yeah.
yes, okay. Okay, this quick PowerPoint, this is about 5 minutes. Another TED Talk on asthma.
It starts with a cough or a wheeze. Soon, your chest feels tight. Your breathing speeds up and gets shallower, making you feel short of breath. These are common symptoms.
We can't hear it at all, hardly.
Around the world, more than 300 million people suffer from asthma, and around 250,000 people die from it each year. But why do people get asthma, and how can this disease be deadly? Asthma affects the respiratory system, particularly the smaller airways, such as the bronchi and bronchioles. These airways have an inner lining called the mucosa that's surrounded by a layer of smooth muscle. In people with asthma, the airways are chronically inflamed, which can make them hyper-responsive to certain triggers. Some of the many asthma triggers include tobacco smoke, pollen, dust, fragrances, exercise, cold weather, stress, and even the common cold. When people with asthma are exposed to these triggers, an asthma attack or exacerbation can occur. But how exactly do such everyday factors lead to an asthma attack? If an asthmatic is exposed to a trigger, the smooth rings of muscle that circle the small airways in their lungs contract and become narrow. Simultaneously, the trigger worsens inflammation, causing the mucosal lining to become more swollen and secrete more mucus. Under normal conditions, the body uses this mucus to trap and clear particles, like pollen or dust. But during an asthma attack, it blocks the narrowed airways, making it even harder to breathe. These effects lead to the symptoms of asthma. Smooth muscle constriction results in the feeling of chest tightness. Excess mucus and increased inflammation can cause coughing, and the wheezing noise? That happens because as the airways constrict, air whistles as it passes through the narrowed space. These symptoms may make a person feel like they're running out of air. Yet counterintuitively, during an asthma attack, the inflammation can make it harder to exhale than inhale. Over time, this leads to an excess of air in the lungs, a phenomenon known as hyperinflation. The trapping of air inside the lungs forces the body to work harder to move air in and out of them. Over time, this can lead to reduced oxygen delivery to the body's organs and tissues. Sometimes, in untreated severe asthma attacks, the body can't keep up, which can lead to death from lack of oxygen. So how do we prevent these uncomfortable and potentially fatal attacks in people who have asthma? One way is to reduce the presence of triggers. Unfortunately, the world is an unpredictable place, and exposure to triggers can't always be controlled. This is where inhalers, the primary treatment for asthma, come in. These medications help asthmatics both control and prevent their asthma symptoms. Inhalers transport medication along the affected airways, using a liquid mist or fine powder to treat the problem at its source. They come in two forms. There are reliever medications, which treat symptoms immediately and contain beta agonists. Beta agonists relax constricted muscles, allowing the airways to widen so more air can travel into and out of the lungs. The other form of inhalers serve as preventive medications, which treat asthma symptoms over the long term and contain corticosteroids. Corticosteroids reduce airway sensitivity and inflammation, so asthma can be kept under control. They're also crucial in preventing long-term damage from chronic inflammation, which can cause scarring of the airways. Inhalers are known to be very effective and have helped many people live better lives. Although we've come a long way in improving how we treat and diagnose asthma, we still don't know its exact causes. We currently believe that a combination of genetic and environmental factors play a role, potentially acting during early childhood. Recent research has even linked poverty to asthma incidence. This may be due to reasons ranging from exposure to additional pollutants and environmental irritants to difficulties in obtaining medical care or treatment. As our understanding of asthma improves, we can continue to find better ways to keep people's airways happy and healthy.
Okay, so I thought that was interesting because do you guys see the basic difference between pneumonia and asthma? You know, pneumonia, that bacteria come down into the bronchus and down into the alveoli, and that's where that infection grows. But asthma is really about those the muscles, the skeletal muscles that are around those bronchus that constrict, and then there's that inflammation, and then all that mucus. And so you can only imagine, you know, when you've seen someone who has asthma, have you seen someone have an asthma attack? It's really super scary. And I can remember as a kid growing up, I can remember hearing about people, or even as a nursing assistant in the 70s in the hospital, people would come in having asthma attacks and people would die. And that was before they discovered these steroids that could really help eliminate that inflammation. And as long as someone who has asthma takes steroids, those steroid inhalers every day, then you eliminate a lot of that inflammation. So if they have asthma, just using those rescue inhalers or those bronchodilators that just open up those bronchus, people don't so much die of asthma attacks today because the medications are just so much better.
Cystic fibrosis act like either of these, is it totally different?
It's a different mechanism. Oh, there's a ton of secretions when it comes to cystic fibrosis, but that's actually a genetic disorder. And I'd have to look it up to find out exactly what, I mean, it's not related to.
Recessive genes.
Is it recessive genes? I'd even have to look that up. Yeah.
My next door neighbor was a doctor and they had a daughter with
Oh,
cystic fibrosis, and she's my son's age. She's a little bit older than my son.
and still alive.
Yes, 60
Yeah.
something, because her father's a
Wow.
doctor.
Wow.
I know, but I know she was running.
Yeah. We're talking about cystic fibrosis, which is a little bit kind of off track, different mechanism that we're talking about, versus when we're talking about asthma. We really need to kind of know those triggers, whether it's, you know, an allergy, you know, if we're allergic to something, it can cause an asthma attack. Molds, our pets, definitely cigarette smoke or dust or chemical odors, grasses and weeds. I mean, it just goes on and on and on. But knowing your triggers and then kind of avoiding them is really key. And again, I thought that video did a really good explanation of showing when you really kind of understand the mechanism of what happens in our lungs with asthma, it really makes sense to have an inhaler that maybe is that combination of a steroid and a bronchodilator. A steroid's going to stop that inflammation, and then that bronchodilator is going to open up your bronchus very, very wide. And people do really, really well on those combination. Those are like the discs, but you should always carry around your rescue inhaler, which is, you know, like your albuterol, and that's just a bronchodilator that if you get into trouble, you know, it's a rescue. Any questions about asthma? Okay, then the last one is COPD. So that's chronic obstructive pulmonary disease, which kind of is kind of an umbrella statement. Sometimes asthma is actually even put in there as well. And we're talking about chronic bronchitis and emphysema. And wouldn't you know, I have a video for that. So is Tim still here?
Tim? He's eating. He was eating.
Tim?
Yeah, he was over there.
Oh, here, I think, no, that's,
She said she got a hotter from this. I liked it then, huh? I liked
hey, Tim?
There he is. I'm behind the post.
Sorry.
Oh.
Where's my COPD? How come I'm not seeing them?
Oh, it's just the third tab here. This one?
Yeah.
Sorry.
Okay.
Understanding chronic obstructive pulmonary disease, COPD.
Okay.
Chronic obstructive pulmonary disease, or COPD, is a lung disease that makes it difficult to breathe. COPD is a long-term disease that often gets worse over time and is characterized by inflammation and severe limitation of airflow in and out of the lungs. COPD is an umbrella term used to describe a group of breathing conditions, the most common being chronic bronchitis and emphysema. Many people living with COPD may have both emphysema and chronic bronchitis. A few people have both asthma and COPD. Cigarette smoking is the leading cause of COPD. Long-term exposure to secondhand smoke or irritants such as air pollution, dust, or workplace fumes, and biomass exposure such as wood smoke can also contribute to COPD. An uncommon genetic disorder called alpha-1 antitrypsin deficiency is sometimes associated with COPD. Although respiratory infections such as influenza and pneumonia do not cause COPD, they can make people with COPD very sick. Therefore, it is very important to keep these vaccinations up to date. At first, COPD may cause no symptoms or only mild symptoms. As the disease progresses, common symptoms include shortness of breath, wheezing, and chest tightness, especially with exercise, and an ongoing cough, often with a lot of mucus. As COPD symptoms worsen, breathing requires much more energy, and it can get harder to exercise or do routine activities like getting dressed or climbing stairs. This may lead to fatigue, weight loss, and muscle loss. People with COPD can experience a variety of symptoms. Different stages of COPD range from mild to moderate to severe. In normal functioning lungs, when air is inhaled, it travels down the windpipe and into the airways, or bronchial tubes, of the lungs. Inside the lungs, the airways branch out into smaller and smaller tubes called bronchioles that are rich in blood supply. At the end of these tubes are billions of tiny air sacs, called alveoli. Normally, the walls of the airways and air sacs are elastic and flexible in nature. Inhaling causes each air sac to fill with air. Exhaling causes each air sac to deflate. Efficient uptake of air into the lungs provides oxygen to the blood, which is then carried to all parts of the body. In COPD, however, the airways become thick and inflamed, and they produce more mucus than usual. This mucus can clog the airways and makes it hard to breathe. In COPD, the walls of the air sacs in the lungs are damaged and lose their elastic quality. The air sacs get floppy, broken, and lose their shape. As the air spaces get larger, air gets trapped, and there are fewer air sacs to supply oxygen to the blood. Because air is trapped in these air sacs, it is difficult for lungs with COPD to deflate like normal lungs. This trapped air makes it harder to get fresh air into the lungs and makes breathing more difficult. COPD is the third leading cause of death in the United States and affects more than 13.5 million Americans. It is predominantly diagnosed in middle-aged individuals older than 40 years and is present in both women and men. Although COPD is more common in men, more women die from this disease each year than men. The rate of COPD continues to increase worldwide due to smoking and worsening air pollution. While there is no cure for COPD, you can take steps to feel better, stay more active, and slow disease progression. COPD can be managed by consulting early with your healthcare provider, seeking diagnosis and intervention therapies, and adopting lifestyle changes that include quitting smoking, pulmonary rehabilitation, healthy eating and exercise, and maintaining a positive outlook.
Just come over here.
For years, California's
So, I think when we originally, I asked, a few of you raised your hand that you have COPD. Do you know if it's, chronic bronchitis versus emphysema?
Mine is emphysema.
Okay, and do you know what your cause was from?
I smoke.
Oh, so I'm asking people in the room, and someone shared that they have emphysema related to smoking. And Mike, emphysema relating to smoking. Anyone? You have COPD related to asthma, because we know it can cause some of that scarring. Yeah, interesting. Anybody on the Zoom call have a diagnosis of COPD if you want to share? So, a lot of the same inhalers that they use for asthma are going to be used for COPD as well. But there's a couple breathing techniques that I wanted to go over with you guys that you may find useful, even if you don't have COPD. But if you're short of breath or you need to kind of start controlling your breath, these may really be very effective breathing techniques. And the first one is just pursed lip breathing. Have you heard of this?
Not an idea.
Okay, so pursed lip breathing is just breathing in through your nose. So I'm going to tell you, I can't talk and do it at the same time, but breathing in through your nose and then kind of pursing your lips and exhaling. So breathe in on a count of 1, 2, and then exhaling at the count of 4 through pursed lips. So in. And I have to say, a lot of this stuff is interesting that you read about, but I always relate it back to being a nurse in the hospital and seeing patients that have COPD, and they naturally breathe this way. Because if you really purse your lips, so like you're breathing through a straw, it actually makes it increases the amount of pressure in your thoracic cavity. And that's going to actually help expel air. So, and again, inhale. Can you feel kind of that pressure? So that's a great way to really control your breathing. Another great one is diaphragmatic breathing or belly breathing. Now, I am not a singer, and I don't play any wind instruments, but I guess anyone who does, they naturally do belly breathing. And I did not know this. So who in here is a singer or does wind instruments? So you guys are natural belly breathers, probably. Okay, show offs. So, because this is not natural to me at all. So for those of you normal people, when you just breathe, like when I breathe, and maybe you can see from just in this Zoom, like I can feel my chest rise. And most of us, when you're breathing,
you do yoga breathing through here.
Okay, yoga breathing is also belly breathing. But I'm just talking about when we're not concentrating on it. I'm talking about myself then, I guess.
Yeah.
My chest rises and falls. But belly breathing is where you really want to concentrate on your belly expanding out and coming in. And a good way to kind of control that is putting a hand on your chest and a hand on your stomach. And what you want to do is when you inhale, instead of having your chest rise like mine normally does, is that make sure it doesn't move, but push your belly out when you take an inhale. And when you exhale, bring your belly in. Inhale. Exhale. So when I really concentrate on my belly going in and out, my chest doesn't rise. And what I can tell you as a nurse in the hospital, when somebody is in trouble with their breathing and you start seeing them using their accessory muscles, it's something you will never forget. Because not only are they, all of a sudden they're, they may be using everything they've got. And all that made me really super lightheaded by doing that. So you really want to be able to control your breathing by using either pursed lip breathing or that belly breathing or yoga breathing or diaphragmatic breathing. So it doesn't come natural unless you're a singer or use some type of wind instrument. It's never come natural to me, but I teach this a lot, so I know how to practice it. Who in here knows how to do the diaphragmatic breathing? Or who uses it? You guys use it? Okay.
And they had one of the students work with me.
Oh, really?
And we did that, and we inhaled for 5 seconds, 1, 2, 4, count of 5, held it for the count of 5, and then exhaled.
But with hand on belly and hand on chest. Yeah, that's great. The other thing I want to talk about just briefly, and then we're going to do some more puzzles, is listen, when you can't breathe well, if you have COPD and you're struggling to breathe, and this is a chronic, eventually people will get onto oxygen. But when you feel breathless, you may start to avoid certain activities that make you feel breathless. Like you may stop coming to the gym, or you're just automatically going to do less. If you feel like you can't catch your breath, it's a super scary feeling, right? And so the less you do, your muscles are going to start to weaken. And that in turn is going to make you more breathless. If those accessory muscles and you become more deconditioned, and that can bring on some depression and anxiety, which again is going to make you want to avoid all this activities that make you feel breathless. So understanding this whole process, because people that have COPD have it through the roof with depression and anxiety, and they tend to do less. So we need to kind of like treat the whole patient when we think about that, and think about people that may be depressed and have anxiety related to being breathless. Okay, so see your doctor and get a diagnosis, because that's the first thing. Make sure you're on the right medications, make sure you're being diagnosed, get the proper treatment plan, and know your breathing techniques, because it can maybe really help you. So I want to finish up with a few more puzzles. So the first one we have here, any ideas?
Let's see. It's a darkness at midnight.
The first one.
Yeah.
How come it's not, it won't come up? Okay. What's the first one? Nobody?
Split pea soup.
Split pea soup.
Oh.
The pea is split. The pea is split. Okay, how about that second one?
Stolen goods.
Okay,
Good.
Linda shouted it from the rafters, whatever. Stole in goods.
Oh,
But you would say stolen goods?
yeah.
Yeah, that's a stretch. Okay, how about the next one?
See eye to eye? No, wait a minute.
Yeah.
I have the wrong one down here.
See eye to eye. Okay,
Well, what do you have?
C3I, what does that mean even? No,
Well,
what
then-
did you say,
I
Rob?
said CI2I, but I guess it's CI2.
Like, don't, we see eye to eye.
See eye to eye, that's what I. that's what-
CI to I.
Maybe your three looks like to me, your two looks like a three.
I don't know what, but, that's bad. Okay, how about the last one on the top row? Yeah, toucan. Okay, the next row, everybody,
What was the last one?
toucan.
Oh, two, oh, okay.
Come on. Step ladder. Okay, the next one should be pretty tripod. Now,
Oh, okay.
I know this one. I only knew it because I wrote it down. Trust me. I would not know this one otherwise. This is the hardest one of all. What?
Cross-check. The
Close.
last one's high school.
Last one's high school. Rose. Last one's high school. Rose jumped to the easy one.
Yeah, but I don't know nothing at all.
So we're looking at the third one, bottom row.
Cross-check. Four square.
I'm not even sure now that I wrote it down that it's right. I have blank check.
Oh, yeah.
Oh, yeah.
Why?
Because there's a square that's empty.
Yeah, there's one.
Oh. Okay, that's bad that I have the answer and I still can't figure it out.
In the
Yeah.
middle of the square, it looks like a cross. If that were red, it would be a red cross. That one is missing in the middle. Well, I can point to it, but you can't. If you
Yeah,
start,
no,
from-
I see it
it-
now, but I knew that it was blank check, but I still couldn't figure it out, but I can now. I can now. Okay.
Because I don't see any checks in there. The blocks.
Like
Yeah.
checkers.
Yeah.
Yeah. Right.
Any questions? Otherwise I actually have to go back to work.
Are you
Yeah.
still working?
Yeah.
Yeah, I'm still working. Round of applause for this group. People on Zoom, round of applause.
Thank you very much for the puzzle.
round of applause for you, Carrie. It was very informative, and at least
Thank
I'm
you.
Good.
probably watch the videos again to make sure I understand the difference, but it was really a good.
Yeah. I think this was recorded, so it'll be on the website. Yes, Linda said yes.